in Central New York. We are live. My name is Jennifer Waters, and I am very happy to be here with you today. I'm going to be talking about something BOE, which is based on experience. I've been seeing a lot of this POV, which is point of view, which is funny. Everything's our point of view, right? Absolutely everything we have that we share with the world is our point of view. And so I thought I would do a little BOE, which is based on experience. My favorite subject is to talk about light. So I just would like to say thank you to Dr. Robert Kiltz. He was the first, I believe, that I know of, and this was a long time ago, the first reproductive endocrinologist to incorporate LED light therapy into his repertoire of adjunctive therapies. So thank you, Dr. Kiltz. He very quickly understood the conversation of nitric oxide and how LED light therapy increases that endogenously, gets the body to create it, and how that can help you along your fertility journey. So we are not surprised that he understood the science behind it in a matter of moments. And then he said, okay, let's go for this, because he really wants to improve your outcomes in the shortest amount of time possible. It is definitely a win-win. So a little bit about myself. I'm a licensed acupuncturist. I've been in private practice for 26 years this month. Yay! I'm also a CNY fertility employee. If you've seen me, it was on a Tuesday. And so that's the highlight of my week, seeing you all in your pre and post acupuncture part of your journey. I've been trying with a tilted cervix. A tilted cervix does not stand alone, right? That generally means your uterus is out of location. And that's another one of my favorite subjects. So reach out to me. I can send you some information about things that you could do possibly to help that. So I began using LED light therapy in my clinical practice almost 20 years ago now. I had a bit of a miraculous recovery myself from a chronic acute injury. That was the first thing that happened. And then many other things happened with me using light, in particular, the LED light that goes over the eyes. That is how we regulate the autonomic nervous system and how we can help with things like seasonal affective disorder, hormone balance, because of the optic nerve. We have access to the optic nerve through the eyes, and then we get into those glands in the head, right? The pituitary and hypothalamus, the master gland. So, okay. So that is part of the reason why I love the system that we use here at CNY Fertility, because of that aspect. So really back to the basics here. What is light? In the realm of light, light has to come from a source, right? The sun is a source. There's lots of different devices out there now. There's panels, there's pad-based system, there's little handheld torches. There's all kinds of things. So there's these things, right? These lights, all of this is in the category of light, and it's all within the electromagnetic spectrum. Now, there are frequencies that are outside the electromagnetic spectrum, like scalar waves and Rife waves and all of these things that are amazing, and they really help bring the body back to balance in a cellular level, and it can be immediate. And I want you to know that also your body is a source of light, right? We now know that our cells, our DNA actually emit biophotons. Not a lot, but some. And so there is some technology that uses like little solar panels to capitalize on the light that you're emitting to create some changes in your internal environment. So, what does LED stand for? Because you're going to hear this a lot, light emitting diodes. And that technology has evolved quite a bit. Sometimes they're called SLEDs, super luminous light emitting diodes. I think that that just means that they're so strong, even if you ran over these diodes with your car, they're not going to break. So, it's nice to have a pad based system where the diodes are sticking out because we want to have contact with the body. There's a lot of companies out there now that have panel-based systems that you can sit next to, which is kind of cool if you're in your office or whatever and you want to get some light. But now remember, this is BOE, based on experience. You want to have the light touching your body. Remember, we're trying to wake up your thyroid. We're waking up your ovaries. We want to increase your uterine lining. These are all things that light is going to help you to do. We want to strengthen your uterus so much that it prevents you from getting endometriosis. It helps on the cellular level to prevent autoimmune disease, which is not a standalone disease. It's a degenerative process. It's the end result of many other things. So we'll talk about that another time. So when you have the pads on your body, you're going to maximize the benefit. This is not just about feeling good. This is not just about, oh, I want to have a happier day and I want to increase my mood today. No, we want to make some serious, lasting changes for you on the bone level, on the muscles, on the ligaments, tendons, on the blood level, how your cells are functioning, in particular, your endocrine system, right? If you're listening to me right now, it's because you're interested in increasing your fertility chances, your fertility outcomes. So that means we're working on the endocrine system. Of course, we want to strengthen your adrenals and your kidneys, and we want the liver to be detoxing well, and we want you sweating every day as part of your purification practices. But really, what we want to do is correct your endocrine system functioning. How is your endocrine system functioning? If your ovaries are off, your thyroid is off, remember nothing works alone. Everything is in a synergistic combination. So, I have created a bit of a protocol for you all to know when to use it. I get a lot of questions. Should I use it if I'm getting ready for an egg retrieval? Yes. What happens is when you place the light pads on your body, you're going to release nitric oxide, which is the miracle molecule from your red blood and endothelial cells. Okay, we can actually prove that new capillaries are formed from that increase of nitric oxide. And that's how we grow your uterine lining. So if your lining is too thin and you want more blood there, this is one option, as well as, solid nutrition, looking at any micronutrient deficiencies. When you add light to the body in those conditions, the results can be quite miraculous. The same with increasing follicle numbers. Now, we know it's not about quality, it's about quantity. And here's the thing, again, BOE, based on my experience, because we know the fluid in your follicles is the environment of which the egg is coming, right? So you're doing the retrieval from the follicles. The follicles are full of fluid. That fluid is a representation of your health, right? The follicular fluid really shows us exactly what's going on for your entire life, if that makes any sense. So the environment for which the egg is going into really matters, because you can work on egg quality for 90 days leading up to ovulation. You can really make some important changes during those 90 days. But if the follicular fluid is not optimal, that egg is going to be damaged, right? So we want to make sure that we are strengthening you as the host, that we are strengthening your terrain, and that we are making sure the 4 tissue types in your body, which we already discussed: bone, muscle, ligaments, cartilage, connective tissue, and nerves. These are the 4 tissue types in your body, that they are well nourished, that they're getting the nutrients, the things that you need. So when you focus on that aspect of your health, Of course, the follicular fluid is going to be optimal and the egg is going to be released in this wonderful environment, and there will not be any oxidative damage to that. Um, okay, so there are easy protocols leading up to ovulation. There's easy protocols post egg retrieval. It's very, very important. If you're doing a fresh transfer in particular, this is where light comes in. We want you to recover quickly. You're only having 3 days in between, right? Maybe 4. So we want to make sure that your uterus, your nervous system, everything is in the best possible state of health prior to a fresh transfer. If you're doing an FET, that's not as important, right? You've got more time, right, to fully recover, to get things back in balance, to get your ovaries back to a place where they're good. Because let's face it, folks, it's surgery. Having an egg retrieval is surgery. So it's very important. Our ovaries need support. They're not getting the support they need. They started talking to me. No, for real. I know it sounds crazy, but our ovaries need support. They're not getting support. So we really need to every day, and we can do that by increasing blood flow to them naturally with doing some Arvigo self-care massage or any kind of fertility massage. Using light therapy is a very easy way to support your ovaries. Making sure your uterus is in optimal position, because sometimes the ovaries get tucked behind or they get pulled on. So we need to get them in a good position so the blood supply, the lymphatic flow, everything is moving well down there, because when there's blockage, then there's problems, right? And we can use light therapy every day, right, to help on the cellular level to support your ovaries. And there's some specific targeted supplements I can share with you to support the ovaries. I believe ovarian bloom is one of them. So that would be great to do that. There's lots of other things as well. We've talked about ovulatory issues. We talked a little bit about egg quality. Oh, here's the thing that you might not know. So light therapy in particular is good for mitochondrial health. And mostly what I hear everybody talking about is the roundabout way to support the mitochondria. It's through the digestive system. Take this supplement, which has to be processed through your liver, kidneys, gut, stomach, small intestine, right? This has to go through a lot of stages to get to the mitochondrial level. Those are the little powerhouses in your cell. So when you use light therapy for mitochondrial function, and there's more mitochondria in your egg cells than any other cells in your body. Isn't that interesting? I recently found that out. So when you're looking to correct on that level, so if you're having egg quality issues, if you're having recurring pregnancy loss, if you are having failed implantation for whatever reason, then we need to look at the mitochondria. How are your cells functioning? What is the inhibition there? What is affecting how your cells are releasing this ATP, adenosine triphosphate? This is the energy, right? So remember, to produce the eggs, to produce the follicles, this requires energy. Right? So without energy, these follicles are not going to grow. The whole reproductive system pulses, beginning with your pituitary gland. It sends out hormones in a pulsation way, like your esophagus is pulsing your food down, like the peristalsis of your GI system, like the uterus as it's shedding its lining, and like the follicles as they are grabbing the egg, right? So this requires energy, folks. So if you're feeling tired, run down, you've got a weak digestive system, you've got loose stools, you've got back pain, knee pain, insomnia, you do not have enough energy. You want to increase that. And when you use light, you're bypassing the gut. You're going right into the cellular level, because when you place the pads or the patches, whatever you're using, it's going through the skin into the blood, and that's where all the cells are. So I highly recommend it for anything related to ovaries, egg quality, anything like that. Light is the way to go. So, one fact you may not know is that when you are 21 years old, you have approximately 2,500 mitochondria in each cell. And as we age, it diminishes. So if you're 35 or 40 or 45 and you're trying to conceive, please consider this as a potent modality. Uterine and tubal factors, absolutely. If you have had an infection in your uterus or vagina or anywhere, if you have had any STDs or anything, you want to make sure you're clearing that up. Anybody that knows me knows I'm not a fan of pharmaceutical antibiotics. Obviously, there's a place and time for everything, but we need to know our options. And there's a lot of really good ones out there. And so I like to think of it as it's a both and world, right? So if you really feel you need to do the pharmaceutical antibiotics because you have a history of infection or a current infection or you have endometritis, whatever, please, please, please consider some natural remedies as well. Whether there's lots of things. And then when you apply light to that, you are really changing the terrain and it's not going to come back. So BOE, based on my clinical experience, what I find is that women that take antibiotics, oral, pharmaceutical, they're good for a little while and then it comes back. Whether it's in the bladder, wherever the infection is, it comes back, or it comes out in different ways. Like I was fine, I felt really good, and then I ended up with a cold sore, which is an immune system dysregulation and a virus. So when you use natural remedies, everything gets better. Your terrain gets stronger, your gut microbiome increases, everything improves. You add light and you are accelerating the body's ability to heal by increasing the amount of energy that we have. So lots of options there. Scar tissue is another issue. Obviously, your tubes are so small. I didn't realize this until getting involved with the fertility world. It's a miracle anybody can conceive naturally or otherwise because the tubes are so easy to influence. One abdominal pelvic infection, boom, your tubes are full of inflammation and possible scar tissue. So this is where you would definitely want LED light therapy, a pad-based system in particular, to go over your abdomen to start to break up scar tissue. Other systems can help a little bit, but there's nothing better than a pad-based system. And I have my own experience with that. One of the side effects I had of using LED light on my lower abdomen was eliminating lots of scar tissue. And that's not even why I was doing it. I'm not very good at multitasking here. So the best thing to do is to email me if you have questions. Okay. Whoever that was that's coming to see me. I look forward to meeting you in person. So, and remember when you're using a pad-based system, you can combine the pad with things like castor oil for scar tissue, or optimizing liver function. You can use, like I said, castor oil. You can mix the castor oil with some enzymes to help break things up. You can take certain specific enzymes for scar tissue internally to help break down scar tissue. All of these are really important. Lining issues, we talked about that through the release of nitric oxide, the capillary growth. This is how we increase our blood supply. We increase the amount of blood that we have circulating. Here's the thing, folks. Most of the women that I see now at CNY Fertility are already working with an acupuncturist. Please ask them for a diagnosis. What are you working on? What are we working on? What do you see going on with my body based on how we've been trained to diagnose through the tongue, through the eyes, through the pulse, through however they're diagnosing, through the abdomen? The body is full of microsystems. Through the ear, we can see things because without a diagnosis, you don't know what you're working on, right? You're in the dark. You're going to get treatment. Somebody else is fixing you. Fine. There's a time and a place for that. What I like to hear is my acupuncturist said I have liver blood stasis. I have congestion in my liver. Okay, that's great. So now every day, all day, you can think about how you're going to influence this with your mind, being creative. You can visualize your liver functioning better through your breath. Okay, what helps move the liver? A lot of deep breathing, breath of fire, different yoga breath techniques are going to help move the liver blood through the clothes you wear, right? A lot of liver blood stasis means you feel irritable, you feel hot. You can wear cooling colors. It's amazing. Color is frequency. This is in the realm of the electromagnetic spectrum and light therapy, where color that you're wearing, what you're looking at, is affecting your body. Of course it is. What you're eating, the liver loves bitter, bitter, bitter. So you can include that in. If you're a coffee drinker, don't layer up the bitter with sweet, right? This is your one chance in the day to actually taste the flavor of bitter, which the liver loves, and it's going to help move it. So I hope you're getting my point. Get a diagnosis, take some ownership of it, and start working on it all the time in your mind. You can ask for help. You can get information. We're bombarded with information all the time. So you can see what's going on around you and use that to benefit yourself and others. So, okay, so how are you going to get access to an LED light therapy system? Look for a practitioner. Google LED light therapy near me. Look, there's people around you, most likely. Lots of practitioners own devices and are using them in the clinic. We have them here at CNY Fertility for you. A lot of practitioners have rentals. So you can go for sessions. You could rent a system and say, hey, I'm getting ready for a retrieval. I really want to do ABC. Could you rent me a system for a week or 2 weeks? Done. There's a lot of people do that. You could buy a system, right? Depending on your budget, it's an investment. It's a class 2 medical device. I do sell them, full disclosure, no pressure. If you're interested, reach out to me. It's whatever works for you. Okay. A lot of acupuncturists, will, like myself and the practitioners here at CNY, we include it, right? If you're coming to see me for a session, I'm going to include LED light. So it's not even an add-on. It's part of the package. And there's lots of acupuncturists now, not like when I started 26 years ago. It's fairly competitive in a good way. And what you can do is find a practitioner near you that uses light. So if you're trying to make a decision, this person sounds great and this one does too, and I don't know where to go, see if they are including light. And if they're not, they should be, and they can reach out to me to find out exactly how, when, why, and where to place the pads to help you. All right, everyone, I have to go now. Thank you for your interest in light, and reach out to me. I'm going to say goodbye to Instagram and try to answer some of these questions here. Instagram, friends and family, reach out to me at jenniferwaters.net. If I can do this, jenniferwaters.net. Email me. I promise to get back to you. It's not a very busy week for me, so I've got time to respond, okay? Okay, let me see. I have about 35 seconds here on Facebook. Very hard. Oh, I'm sorry. I know it's really tough. Oh, yeah. Email me. I want to answer your question, Wormwood. Okay. I remember your name. Oh, both tubes are completely blocked. LED light is going to help. I will give you information about all of that, combining castor oil with the enzymes and light. It's really works. Marcia, how often? It really depends on time, energy, budget, location. Okay. Go to my website. You can email me there, jenniferwaters.net. Okay. And I have lots of recommendations for you, Tony. Lots. It's very important because synthetic vitamins are killing you. They are not your friend. Okay. It really matters. Oh, NAD infusion. Good. That's the precursor to all the stuff that you want. Okay, everybody, have a wonderful day. Reach out to me, and I look forward to connecting with you.